Hello and welcome to the BloodStream Podcast, a show serving the greater bleeding disorders community, brought to you by Believe Limited and BloodStream Media. I am your patient advocate and host, Patrick James Lynch.
And I am your healthcare advocate, your nonprofit nerd, and your other host, Amy Board, reminding you to please speak with a healthcare professional before making any treatment decisions. On today's show, we have a special partnered episode focused on hemophilia A and B, 12 years of age or older with inhibitors. We'll hear from Dr. Tami Singleton, who will join us to talk about inhibitors, the challenge patients and caregivers face, and treatment considerations, including SEVENFACT. Important safety information. What is the most important information I should know about SEVENFACT?
The most serious possible side effect of SEVENFACT is abnormal clotting involving blockage of blood vessels, which include stroke, blockage of the main blood vessel to the lung, and deep vein blood clots. You should know the signs of abnormal clotting and seek medical help immediately if they occur. Signs of clotting in places other than your site of bleeding can include new onset of swelling and pain in limbs, new onset of chest pain, shortness of breath, loss of sensation or motor power, or altered consciousness or speech.
What is SEVENFACT?
SEVENFACT is an injectable medicine used for the treatment and control of bleeding episodes occurring in adults and adolescents 12 years of age and older with hemophilia A or B with inhibitors. Injecting medicines requires special training. Do not attempt to self-infuse unless you have been taught how to by your healthcare provider.
Who should not use SEVENFACT? Coagulation factor 7A.
You should not use SEVENFACT if you are allergic to rabbits or if you have known allergies to SEVENFACT or any of its components. Seek immediate medical help if you experience hives, itching, rash, difficulty breathing with cough or wheezing, swelling around the mouth and throat, tightness of the chest, dizziness or fainting, or low blood pressure after taking SEVENFACT. Tell your healthcare provider prior to using SEVENFACT if you have begun treatment of a bleeding episode with another bypassing agent.
What should I tell my healthcare provider before I use SEVENFACT?
Tell your healthcare provider if you are pregnant, are nursing or plan to become pregnant, if you have had prior blood clots, heart disease or heart failure, abnormal heart rhythms, prior pulmonary clots or heart surgery, or if you have or have had any other medical conditions.
What are the possible side effects of SEVENFACT?
The most common adverse reactions for SEVENFACT are headache, dizziness, infusion site discomfort, infusion site hematoma, and infusion-related reaction and fever. Seek immediate medical help if you have signs of a blood clot or an allergic reaction. To report suspected adverse reactions or product complaints, contact Hemobiologics at 1-855-718-4362. You may also report suspected adverse reactions to the FDA at 1-800-FDA-1088. To see full prescribing information, visit 7fact.com or contact Hemobiologics at 1-855-718-4362.
And this is really, I think, a very important topic, especially for families managing inhibitors and learning about bypassing agents. So we're really grateful to have this conversation on the show today.
We have got all of that on this special episode. Welcome to BloodStream.
Listeners, thank you for joining us today. And if you like what you hear, please share this episode with friends, with family, on social media, and of course, subscribe to the BloodStream Podcast wherever you listen to those podcasts.
Today's episode is sponsored by Hemobiologics, and Dr. Singleton is compensated for her time. We appreciate the opportunity to share educational information with the community.
And with that, here is our full conversation with Dr. Tami Singleton.
Dr. Singleton, thanks for joining me today. It's good to see you again here in the BloodStream Network.
It is great to see you as well, Patrick.
So let's dive right in. For listeners who may be newer to this particular topic, can you explain what inhibitors are?
Absolutely. So inhibitors are antibodies, basically. And I think we have all heard the term, antibodies. So in response to something that your body thinks doesn't belong, right? Or in response to something that your body has never seen before, doesn't see frequently, feels that your body needs to fight. The system will generate antibodies to attach to whatever that is to protect you and remove it from your circulation, right? From your bloodstream. It just so happens that sometimes the body detects something that seems to be foreign, that it doesn't necessarily see that often, that may just be kind of important, to kind of hang around. So in hemophilia, when we talk about inhibitors, they are inhibitory antibodies that when you don't make factor 8 or factor 9, or you don't make large quantities, right, of factor 8 or factor 9, that when exposed to an exogenous product, so when exposed to something that is being put in to the system, like factor that is being put into the system, that your system will say, hey, hold on, what is that? I'm not sure that that's supposed to be here. Now recognizing it as self, and will attach antibodies to it to protect you, to remove it from the circulation. So when that happens, and you just so happen to have hemophilia, and you need to infuse factor 8 or factor 9, those inhibitory antibodies that are formed against that factor 8 or factor 9 that has been infused, and will remove it from the circulation. So when we say inhibitory antibodies, that antibody is stopping or inhibiting factor 8 or factor 9 that we've put into the system from functioning and contributing to thrombin generation and the formation of a clot. If that makes sense, right?
Yeah, it does.
And I'll add one other thing to it to make it make sense. I was talking to somebody about this yesterday. So one of the allergies that we're incredibly familiar with, right, is like a peanut allergy, right? We know that people have peanut allergies, and typically there's like a severe reaction to that. Mm-hmm. So when you have been diagnosed as having an allergy to something, that means you've developed antibodies, right, against something. Even when we treat it, even if you don't have a response necessarily every single time, it's still there, right? The potential, right, is still there. So history of an inhibitor that's not detected because you haven't been exposed to factor 8 or factor 9 in a long time, doesn't mean, right, that it's not there. Like that potential can be there. So it can get a little complicated, but what's important to remember is that an inhibitory antibody, an inhibitor, is an antibody that has been formed against the exogenous product, against factor 8, against factor 9, to kind of fight factor 8 or factor 9 that can be infused or put into the system.
And how does that inhibitor then change the way patients experience and ultimately manage their hemophilia?
Yeah, that's a really good question too. So, and herein lies some of the complication, right? So you have formed these inhibitory antibodies. Well, they're slightly different variations of those inhibitory antibodies. So, and this might make sense. If you form antibodies and they're around in your circulation in a larger quantity, like there are more of them, present, it may make sense that if there's more of the antibody present, that when you go to infuse that product, or that product is present, factor 8 or factor 9 is present, that there's a rapid response in attaching to it and clearing it from the circulation. But if you have antibodies or inhibitors around, and it's not necessarily in very large numbers, like a large quantity, that it may act to remove some of it, but not necessarily all of it. So when we talk about inhibitors in hemophilia, and these antibodies in hemophilia, we have a dividing line. The units is called Bethesda units. So if you're greater than 5, then that's a higher titer, more of those antibodies around. And we know that more likely than not, if we were to give you doses of factor 8 or factor 9, if it's greater than 5, that it's not going to remain in circulation to be effective.
Got it.
And so in that instance, how do you clot? Like, how would you form or generate thrombin? Like, how would you form a clot? How would you respond? Well, that's when we need things other than factor 8 or factor 9 present to generate thrombin so that you can have clot formation, because infusing factor 8 or factor 9 is not going to cut it.
Mm-hmm.
But if you have inhibitors that are present in that less than 5, so a smaller quantity, it's possible that we could give you higher doses of factor 8 or factor 9 and overwhelm the inhibitor, right? Because there's not that many of them around. And then you can have clot formation as a result of that. So that's that kind of dividing line for us in hemophilia, that Bethesda unit assay of greater than 5 or less than 5. Sometimes we will refer to some of those inhibitors, if it's less than 5, sometimes they're transient, meaning they appear, we pick them up, and then later we don't pick them up. But sometimes, even when we don't pick them up, it's almost as if it's there in some low level, right? And so we may have to use higher doses to accomplish the same goal. So that's the traditional, like, dividing line. And traditionally, before we had the use of non-factor replacement therapies, traditionally we would have to use a bypassing agent for those people who had like those higher titers. And we would use higher doses of factor for people who had those lower titer inhibitors, right? Because remember, lower titer, lower number of antibodies present, lower number of inhibitors present, you may still be able to use factor 8 or factor 9, but just in higher doses.
Right. Okay.
If you had more of those antibodies, we would have to skip over the need for factor 8 or factor 9, understanding that it wasn't going to be present, and we have to have something to generate that thrombin. And that's when we would have those APCCs and the recombinant factor 7As of the world as a bypassing agent. So the way I would usually describe that, I would go, well, you can skip over the party that's happening on the surface of the platelet between, factor 8 and factor 9, activating factor 10. A bypassing agent skips over that, and we just kind of force activate factor 10 by having larger quantities, typically of recombinant factor 7A around, right? So we're force activating factor 10, and that's the bypass. You're not using factor 8 or factor 9. We're kind of force activating factor 10 with thrombin formation, and that's that bypass. Like, we're literally hopping over that step.
And if I'm not mistaken, SEVENFACT is one of these therapies that's available today for patients with inhibitors, one of these bypassing agents, so to speak. Can you tell us a little bit more about SEVENFACT and how it works?
Sure. So SEVENFACT is a recombinant factor 7A. It's also referred to as epticog beta. And as a recombinant factor 7A, it does just as I previously described. It helps to form thrombin and ultimately a clot formation. A clot can be formed by skipping over the need to have factor 8 or factor 9 present and kind of force activating that factor 10 so you have clot formation. So that's what's happening sort of on the level of the surface of the platelet, right? There is also some data, preclinical data, that says, or that shows us that epticog beta, as SEVENFACT, also has some activity in stopping the natural anticoagulant pathway involving protein C by kind of blocking a receptor for that too. So there's some data showing that it blocks a little bit of that natural anticoagulant pathway with protein C by blocking a receptor that's in the endothelium. And it has that bypassing agent or that bypassing activity by skipping over that factor 8, factor 9 step that's needed for factor 10 activation. You go straight to that big boy with that recombinant factor 7A, as I refer to it, with the epticog beta, and you have thrombin formation. So it is absolutely a bypassing agent. It is a recombinant factor 7A, And that's the mechanism by which it can work to help us to form clots. When there's a person living with hemophilia A or B, 12 years of age and older, living with inhibitors.
And beyond that, from your experience, Dr. Singleton, what should patients and caregivers know about using SEVENFACT in real life?
Yeah, absolutely. So what I think you should know is, first, always make sure that you have a very detailed conversation with your provider. If you're an inhibitor patient, if you're a patient living with hemophilia A or B, living with inhibitors, 12 years of age and older, and you need a plan for bleeding episodes as they occur.
Mm.
So if you have a bleeding episode and it occurs, what is going to be your plan with your provider? You're going to talk to your provider. If I have this episode, what am I going to do? Are we going to have a phone call? What product am I going to have available? How am I going to use it? What is going to work best for me or for you? If that is decided that that's SEVENFACT, epticog beta, then it's recognizing that epticog beta, SEVENFACT, is a bypassing agent as a recombinant factor 7A, that when you have a bleeding episode, that you can use in a dose that you and your provider have discussed previously. Now, one of the things about SEVENFACT is there are actually 2 different doses that can be used for mild or moderate bleeding episodes, and there's a dose that can be used for more severe bleeding episodes. Again, this is something that your provider would walk you through in terms of how to use it at an appropriate time for you. So when you use SEVENFACT for those breakthrough bleeding episodes, it will be used as an infusion, intravenously, IV push, it's given. And it can be given as a 75 microgram per kilogram dose or a 225 microgram per kilogram dose. And so when those 2 doses are given, you'll kind of work with your provider to decide, when I'm having a mild to moderate bleeding episode, which dose should I start with? Like, what will work best for me? And then you can walk through, if I need a second dose, when would I give it and what would that dose be? So typically second doses, regardless of if you're using the starting with that 75 dose or starting with the 225 dose, second doses will be the 75 dose and can be given at different intervals depending on if it's a mild or moderate bleeding episode, or if it's a severe bleeding episode, the recommendation is typically that you start with that 225. But again, it all starts with a conversation with your provider about SEVENFACT, if that's appropriate for you, and which dose you would start with as that initial starting dose when you're having a bleeding episode. And so you'll know how to use SEVENFACT in a way that works for you.
As we talked about at the beginning of the conversation, Dr. Singleton, inhibitors are game changers in the lived experience and management of hemophilia. I know that from personal experience. And it can be a lot, not just on the patient, but on the entire family. What resources or support do you recommend for families who are navigating inhibitors and new treatment options?
Absolutely. So it's that question, just makes me sort of think about how amazing I think the hemophilia community is in general. Most patients are pretty informed. And even for those patients that are not informed, the willingness from an advocacy standpoint to coalesce together, right, to support each other and to support other patients is a very strong, I think, community. So in terms of what do you do and what resources do you have? Again, first, starting with your treatment team. Your treatment team is always going to be the place they know the most about you, the details about you, kind of what works for you. If you have questions or concerns, that's always going to be the source that you go to first because they know more about you as an individual, to make sure that you can get those questions answered. And one thing I think is important to remember too is sometimes you may really know or understand something, but being able to repeat it to another person, right, can be difficult, to
Definitely.
explain. You know what I mean? So I
Mm-hmm.
think that that's why starting with your treatment center, your treatment team is always a great place, because that's going to be like the source of truth about you as an individual and your medical facts. So that if you
Mm.
have questions as you go out and have additional support from the amazing hemophilia community and advocacy organizations and support groups, and and other kind of close-knit resources in the community, you can then take that information, kind of go back to the source and say, you know what, I now have a better understanding and I have additional questions. How does this apply to me? So that you can be really informed and have a solid treatment plan that really works for you, both from a medical standpoint and a life standpoint. The other part of that is just having a generalized awareness of the treatment options that are available, and then working with your provider to understand which treatment options work best for you. So I
Mm.
think it's almost like a triangle, right? With the
Mm.
patient or the family sitting in the middle, where you have your treatment center, your team, always being the place kind of at that apex where you're going to go back to understand what really applies to you as an individual, followed by that awareness and support that can come from the community, various resources, amazing advocacy organizations and support, and then that knowledge and understanding of what's out there, what's even emerging, and what applies to you. So
Mm.
I think if you're, an inhibitor patient, thinking about it in terms of that triangle with you being in the center and having the ability to sort of always go back and forth in both directions to ensure that you have the appropriate information. And it is never wrong to have more questions than answers. I think a lot of times, you're on the right path, right? You have answers, but then to constantly have those questions, I think is incredibly important. And I know you didn't ask this, but I'm going to slip in something I think is pretty valuable that I use as a patient when I'm in the role of a patient. Of course, I have the advantage of being a provider, right? And understanding certain things and knowing how to navigate, right, the system. So I have that advantage. But as a patient, I often find if I don't write things down, I
Mm.
may leave a visit feeling pretty dissatisfied,
Mm-hmm.
right? Or, not complete. So there's still some anxiety left there. And I also feel it's almost like you have stage fright, right? You only have so much time to talk to your provider. There's so many things you want to say, and you want to get them in, but you want to sound right, like you want to make sure that you're getting it in. I actually just did this yesterday, but instead of doing what I'm going to share with you, I write it down in notes on my phone, and I go, okay, even days leading up to the visit, I'm like, all right, what are the things that are important to me that I want to communicate and that I have questions about? And so I will go through those questions, like with my provider. Like I'll go, wait a minute, I have a few questions I want to address, if that's okay. And I'll kind of fire away question by question to make sure that they're answered, and and that way I feel fulfilled. I'm not left feeling, well, no one heard me, they didn't listen to me, kind of not satisfied. Sometimes I don't get the answer that I'm looking for, and that's okay.
Mm-hmm.
um, I may find a different way to ask the question, or I'll make sure I circle back to it. So even if I circle back to it by talking to my physician's nurse, after the visit and go, hey, we talked about this, but can you help me to kind of just clarify what my options are with this? I just had a few additional questions, or I'll save it for another time. Now, just yesterday, I actually went to the doctor, and because my list was only 3 things, I felt like I could remember them without writing them down.
Uh-oh.
Yeah. So I went through and I kept going. I'm going to date myself by saying this. I'm a child of the 70s. So Sesame Street, a loaf of bread, a container of milk, and a stick of butter. If you don't know it, look it up. I'm sure you can find it somewhere. It's so cute. So I would go, okay, a loaf of bread, a container of milk, or a stick of butter. No. And I would go number 1, number 2, number 3. Okay. And he answered my questions. One of them, I don't know if I really liked the answer, if I understood,
Mm.
if if I understood the answer. So I made a mental note to myself and then I wrote it down. Like, okay, I'm still concerned about ... I have a plan for now, but here's where that communication comes in. I'm going to follow his plan for now. If it doesn't work out, I'm not going to suffer in silence. Dude, I'm going to call this nurse back up, like in the next couple of weeks or, month or so, and say, hey, listen, Dr. Sherman told me to do X, Y, or Z, and I've been doing it, but this is getting worse, right? Or it's not really working. Because from a physician standpoint or provider standpoint, when we put a plan together, it's working until you tell me otherwise. You know what I mean?
Sure,
I don't know
yeah.
that it's not working.
Right.
You're out there frustrated and you don't know that it's working. So I think that communication piece is important. I'll also share that I think it's important, and I'm going to take my own advice and do this today with one of my doctors. I'm going to send a note right in the portal and say, hey, the plan that we came up with is working. So for example, if there's a plan, a patient is using SEVENFACT for breakthrough bleeding episodes, and it's working well. We said that we were going to put this plan together. I'm going to use, we said we were going to use 75 if I have a mild or moderate bleeding episode. I had one, I used it, and it worked. Or I had one, it worked okay. So then a few months later, when I had another one, we talked about using the 225. So I used that. That worked better. Or whatever it is, right? I think that it's important to communicate in the interim, right? Good or bad. So that way you continue to have the loop, right? That's closed. And I think it decreases anxiety. You feel better just in general about your treatment. And I think the more you communicate with someone, you establish a relationship.
Mm-hmm.
Even when things are going well. Hey, I want to circle back to you and let you know, how things are going. So
by accounting for when things are going well, it can be easier to see when things are starting to get off course, as opposed to having to wait for it to get totally off track and then noticing something's wrong, right?
Exactly. And again, a little tip. I always make sure most providers have someone who supports them, right? If it's a nurse, it's usually a nurse, right? So if there's a nurse practitioner, there's a nurse who's supporting the nurse practitioner or that team, right? If it's a physician, there's a nurse who's supporting that physician team. Like there's someone that you can communicate with while your provider is moving all over the place, right? They may not have time to talk to you that day. So, kind of back in the old days, that would just be just a phone call. Hey, can I call you? I'm going to call Nicole. Hey, I'm going to call Allison. Hey, Allison, I just want to leave a message. I think I need to be seen again. I tried to make an appointment. There was nothing available until April. But is there a way that I could come in because I'm concerned with blah, blah, blah? Whatever that is. And so just that ongoing communication, knowing you have someone that you can communicate with.
Mm-hmm.
Step out there a little bit and communicate. If you call and you try to communicate and you don't get a follow-up, try to extend some grace. You know what? We get busy, we overlook things, we don't intend to. Call back again. Hey, listen, I called yesterday or I called 2 days ago. I didn't hear back. I just want to circle back and kind of put this on the radar. Here's a concern that I have. One of the things that we can do now with some folks in communicating with our providers, people have portals. You can leave messages. Mm-hmm. You can type things on your phone, on your phone. They can see it like in real time. If you're not tech savvy and, don't really understand how to use a portal, you can still make I call them old-fashioned phone calls to your provider. So communication, I think, is key. And sometimes, if we feel anxious or something isn't working well, sometimes there can just be a breakdown in communication. So I highly encourage everyone, communicate with your providers, write things down so that you don't forget them.
Yeah, that's a great tip and one that I certainly need to put into practice in my own life more often. I also want to highlight for everyone listening and watching that if you're interested in more or hearing real patient stories about life with 7Fact, you can visit 7fact.com/7fact-life-stories. We'll have a link in the program notes, but again, that is 7fact.com/7fact-life-stories. Dr. Singleton, as we think about patients with inhibitors, treatment options, and what those patients and families are thinking about today, do you have any final message or words of wisdom that you'd like to offer to those that I just described?
Absolutely. So, I think that we are living in a time now where we have more options available from a treatment standpoint, including patients with inhibitors. And so talking to your providers about what those options are like for you. If you're living with inhibitors and you're having a bleeding episode, and especially since we're talking about 7Fact, right? Let's talk about patients who are living with inhibitors, hemophilia A or B, and if you're 12 and older, putting things in context, what kinds of things are available generally for me? What are my options? If something isn't working, what else is available? Just so you can have that general fund of knowledge. If you're having a breakthrough bleeding episode, what steps should I take? And if you have a conversation with your provider and you have your solid plan down, okay, if I have a breakthrough bleeding episode, here are the steps that we're going to go through. Step 1, step 2. I'm sure there's always going to be a phone call that's going to be involved there, but you may have some general instructions, kind of upfront. I think it's important, and especially if 7Fact is a part of that conversation, that the initial dosing options if you're having a mild or moderate bleeding episode where your doctor sort of wants you to start, based on your history. You're going to start with a 75 microgram per kilogram dose, a 225, like what's going to work, best for you in terms of those dosing ranges. And then what's going to be the follow-up? Like what is that plan going to look like for me? So I think it's just important to try to have something that you know and understand, and you don't have to memorize it. You can put a note like in your phone. You can have a place. Don't be afraid to keep notes. Like I'll show you like kind of old school, paper notes. Don't be afraid to do that, to have a place that you can go. So once you have that plan in place with your provider, and then don't be afraid to reach out and ask additional questions. Hey, this is what I thought I was supposed to do. Can I follow up and let you know how it went? Or I have some additional questions. So I think it's incredibly important to communicate often, to have a plan that's right for you. And I think it's also important to know that you have tons of support in terms of advocacy in the community. You receive tons of support in terms of, how it feels and where you can go and things that you could do. But always know that the only source of truth in terms of your actual treatment and your individual plan is going to be your treatment center and your providers. So sometimes if you go spinning off into outer space because there was a conversation and you're like, wait, does that apply to me? Like, should I really worry about that? To kind of go back to that source of truth to make sure that you can level set to understand how to use that information in a helpful way for you, and try to stay informed, right? Like what's out there in terms of possibilities, even just, kind of the conversation that we're having today, trying to take things in like that and to use some of the conversation recommendations in ways that are helpful for you, but just to know that you're not alone. You can be informed and you can find a plan that works well for you. And if that includes 7Fact, then you'll have plans for that for you coming from your provider.
And again, you can check out those real life stories by following the link in the program notes.
Absolutely. And the cool thing too is we're living in an age where you can replay things. right? So you can listen to something, you could listen to it again. You could use resources from websites to kind of reinforce the knowledge and information that your provider has given you, that your team has given you. So you could go to the sites like the 7FACT site and get that additional information for reinforcement. So there are lots of tools and tips that are out there to provide that additional support for you.
Dr. Singleton, from your experience, what should patients and caregivers know about using 7FACT in real life?
Yeah, absolutely. So I think first it's incredibly important that everyone always start with communication and a plan that's coming directly from your provider, right? Because treatment is very individualized. So that is the place where all things start. It's also important, and I think this will be a part of your treatment plan and your discussion with your provider, that there'll be instructions in terms of treating bleeds and how to treat bleeds promptly. But since we're talking about 7FACT in particular, once you have that plan from your provider, and if 7FACT is a part of your plan, because 7FACT is approved and can be used in patients that are 12 years of age and older, if you're living with hemophilia A or B with inhibitors and a bleeding episode occurs, then those instructions again coming from your provider will include that 7FACT will be administered as an IV infusion. And you typically have training coming from your team in terms of exactly how to infuse before you use it. And then you'll receive instructions from your team that there are 2 doses that could be used if you're having a mild or moderate bleeding episode. And those typically include a dose that is starting with 75 micrograms per kilogram or 225 micrograms per kilogram. And again, those appropriate doses will be individualized for you and will come, those instructions in that shared decision-making way will come from conversations with your provider and your HTC team. And so one of the things that's important to note too about 7FACT is it can be kept at room temperature. It's stable before reconstitution at room temperature. And you want to make sure that it's stored appropriately, that if you have to travel, that you travel with it appropriately. And so you make sure that it's protected at room temperature. And when it's prepared in preparation for that IV infusion, that it's administered exactly as instructed by your doctor, your healthcare team, your provider. So again, all of those details will be discussed with you and your provider if 7FACT is your in your treatment plan for those breakthrough bleeds, on-demand bleeding. And you want to make sure that you follow those very specific instructions that have been laid out for you. In addition to that, typically when you're talking to your provider, you'll review some of the risks that are involved with using 7FACT. And so you'll go through things like 7FACT could potentially cause thrombotic events or blood clots, and you'll talk about any risk factors that you may have for thrombosis. Additionally, you'll probably talk with your provider about having any other symptoms that could be associated with 7FACT, if you could possibly have an allergic reaction, if you could have anaphylaxis that could occur, and some of the things that could be, some of the symptoms that can be associated with thrombotic events or blood clotting. You also discuss if you could have a localized reaction, including itching or injection site reactions. And we want to make sure that you're using 7FACT only for its approved indication and that you'll follow all of the instructions given by your provider for preparation, the dosing that's appropriate for you, and remember to administer it because you're going to receive those specific instructions from your HTC in terms of exactly how to infuse and how to use the products. So just remember, these decisions are very individualized. It's going to be made between you and your provider, your HTC. That's going to include the dosing, how it's going to be stored, the safety considerations, if any monitoring is needed, if you have a bleeding episode that occurs. You're going to discuss all of those things and a follow-up plan, maybe even after you have a bleeding episode with your particular team and your HTC.
Great information. Thank you for that. Well, Dr. Singleton, thank you for joining us and sharing your insights on hemophilia with inhibitors and 7Fact. Listeners and viewers, again, you can go to 7fact.com for more information on 7Fact. And again, always speak with your healthcare provider before making any treatment decisions and to determine the best plan for you. Thank you for listening to the BloodStream Podcast. Be sure to subscribe to hear more conversations like this the moment they go live.
A huge thank you to Dr. Singleton for joining us today and for sharing her insights on hemophilia with inhibitors and 7Fact. And thank you to Hemobiologics for supporting this special episode.
Thank you, Hemobiologics. Okay, Bordeaux, our next episode comes out next week. How about that? What can the listeners expect to hear?
Well, you're just going to have to stay tuned to find out.
Okay.
It's a mystery.
Wow. Oh, I like what you do with your hands there.
Yeah, and you have to do the little waves.
Wow. All right. I love a good cliffhanger, so I'll take it. And with that, that is all for this special episode. Be sure to subscribe to the BloodStream Podcast wherever you listen so the next episode is delivered the moment it goes live.
And loyal listeners, as always, email us at mailbag@bloodstreammedia.com to inquire about BloodStream Media and Believe Limited casting opportunities.
I am your host, Patrick James Lynch.
And I'm your other host, Amy Board.
And until next time, take self-care of yourself. Bye, everybody.
Bye-bye.